Started with a tiny team and a huge vision. The vision was pretty simple. The notion that we had back then is that we could do something extraordinary, that we could become the best of the best at what we do, that there was room for improvement in the world of care for women affected by breast cancer that was so substantial that we had to do it.
I left my job of 17 years in the OR because I felt what they did was so important, because as I seen these women come through, I said what their concept and what they're all about was amazing, was absolutely amazing, and how they cared and loved people.
We got exposure to a lot of the hospitals out there. We pretty much operated almost every one that was in Southeast Louisiana, and found that there were a lot of inefficiencies there. There were some lapses in care and quality of care. Seeing that, we became very inefficient operating different facilities, and when we tried to localize our stuff, we're operating till late because the ORs weren't turning around quickly enough, and that the quality of care on the floor was inadequate for our monitoring of the patients and their recovery. We decided we wanted to try to create a better experience, to try to control the environment, to control the quality.
And as we got busier and busier, there really was not a facility that could accommodate us.
Before Katrina, they were really getting underway with getting this site, as far as the clinic is concerned, built and refurbished and outfitted to be a facility that they could see their patients in and consider it as their office.
Shortly thereafter, after they began to do the demolition and been ready to build out the ORs and such, is when Katrina hit.
And so through whatever reason, whether it was temporary insanity, divine inspiration, some combination of both, it occurred to me that we might be able to acquire more of the block than we had at that point. In some very, very real ways, this entire facility is the house that Katrina built. Had Katrina not happened, that opportunity would not have been there. And then the funding and the financing that supported the build-out wouldn't have been there either.
Without the space, we would have cramped quarters. You can't deliver a product or the service or the security or the plushness that we wanted without the space.
The collection of events that came together to make all that happen were meant to be. This place is a place that's different because of purpose. The facility was designed in a very carefully orchestrated way so that it wasn't just a place to come and have an operation, not just a place to come and have surgery. It was designed to be a place of healing, a place that's about more than the operation itself, a place that's about the overall person. A recognition of the struggle they're going through, a recognition of the fear of cancer, of surgery itself, of all the things that go with that, a concern for their family, and the fact that they're going through it with them. All of this from the very beginning, even back then, where we wanted to become the world's best, was about the people we take care of. We did it for them. This place was built around a set of services that were designed for elevation of the standard. for the women that we take care of.
I mean, I've worked in dozens of hospitals, and there's no other place like this in the world. It's like a family. When everyone works together as a team, you never feel like you're on your own. You always feel like you have support.
There's constant innovation going on at the facility as well. It's not just, we haven't just picked an operation and kept on with the same operation. From the preoperative experience to the operative intervention to the postoperative care, you know, it's a constant strive to give patients an even better treatment and experience than possible. And so, you know, I'm just amazed every day from them and from the people that we surround it at the effort that goes into to treating these patients.
Part of our belief that the emotional component of the recovery and the physical component of the recovery go hand in hand. There's a lot of attention paid to the fine details and restoring the patient to wholeness.